All right. Well, it is 2 o'clock Eastern, so we're going to get started. I want to welcome everyone to today's webinar, Rural Transit Planning in the Time of COVID and Beyond. My name is Liz Taylor. I'm the Assistant Director at National RTAP. We're really excited about today's presentation by Ken Hosen. We hope it's helpful as we start to see the glimpse the light at the end of the tunnel of COVID-19. Before we get into the presentation, I'm going to go over a few slides about Zoom and National RTAP before I turn it over to Ken. So you have a couple options for audio today. You can use your computer or you can dial in. You can use one of the phone numbers listed and use the meeting ID and the password. If you have any issues with audio, let us know in the chat and we'll try to assist you. You can also use chat to engage with the other attendees or with the presenter, but please use the Q&A for any questions that you'd like Ken to respond to. He will be taking questions halfway through the presentation and at the end. I assume most of you are familiar with National RTAP, but just in case you are not, we are a technical assistance center funded by FTA through the Section 5311 Rural Area Formula Program. We provide free training materials and technical assistance to rural and tribal transit providers, and we support the state RTAP programs. We have a review board that helps guide our product development. That's state DOT staff and rural and tribal transit agency staff. We're located in Massachusetts, that's where I am, and we have an office in Washington, DC. And learn more at nationalrtap.org, and our contact information will be at the end. Please reach out if you need any assistance. And now I'd like to introduce Ken Hosen, Vice President of KFH Group. We're excited to have him share some of his wealth of knowledge with us today. He is a transportation planner and operations expert with over 30 years of experience with transit systems of all sizes. He's also a nationally recognized trainer with hands-on transportation management and operations experience in the public and private sector. He has served on the CTAA Certification Council and as a member of the APTA Access Committee, and he's delivered presentations at some of our conferences in the past, some of our pre-conference workshops. So if and when we have those again, hopefully Ken will do another hands-on workshop, but we're excited about having this today. So with that, Ken, why don't you take it over and you can control your PowerPoint.
Great. Good afternoon, everybody. Good morning, midday to all of you. I'm going to first go ahead and get rid of myself so that you don't have that incredible distraction. Okay, today, rural transit planning in the time of COVID and beyond. This is an evolving topic, something that as a consultant, all of a sudden, I realized we had to grapple with this. Everything is different now, and we need to adapt and adjust.
Wait, Ken?
Yep, I got to share mine, right?
That's right. Yeah, I just wanted to make sure that you weren't advancing your slide because we're on my version. I'll just stop sharing.
Okay.
There we go. Great. All set.
Okay. As an agenda for today, what we're going to talk about, we're going to start with the introduction, well, mostly done already, and talk a little bit about the webinar objectives. And the main topics we're going to talk about today is starting with changes, the future of transit, and talk about the new normal, whatever that's going to be. We don't know yet. Then we're going to talk about rural transit service planning, just the basics for about 10 or 15 minutes. As Robin and Liz and some of you know, I could talk for 2 days on the topic, so we're going to reduce it to about 15 minutes. And at that point, after that, let's stop and I will take questions. So if you have questions on the first part of this, the service planning, the new normal, the change, that would be a great time to ask those questions. And then we'll continue on with the planning for the phases of change related to COVID. And from there, we'll take questions. Okay, my staff keep putting this on my slideshows, and I've taken this one off twice. But yeah, I used to drive a cab. I used to drive buses. I've managed a few transit systems, and I like consulting better. Our overarching philosophy for all of our projects, for everything that we do, is to help provide more trips for more people while providing cost-effective, high-quality, and safe transportation. I think that's pretty much everybody's goal that's listening in on this webinar. At least I would hope. So just as part of our introduction, COVID, definitely our least favorite subject. I'm working with a number of my clients who are very concerned that their ridership is extremely low and what can they do. And when I inform them that you and everybody else is in that situation, all of a sudden they felt a little bit better. A lot of people hadn't realized that that everybody's hurting right now, and virtually all of transit is hurting. The road to recovery, as you all know, waiting 10 months now starts with patience, and I think in the end we will get through this, and transit will be back to a new normal, which won't be a bad thing. Okay, some of the objectives. This webinar is geared for all types of rural transit, whether it be of a fixed route, a flex route, a fixed schedule type service, some form of demand response, or other types of hybrid services that some may be running out there. So it really doesn't relate to a specific type of service. We look at all of it. Some of the objectives, basically in the form of questions: what are the steps you should take to plan your way out of the pandemic? When should you take those steps? And how can transit regain the confidence of the riders? Because confidence riders having confidence in the system is absolutely essential in these times. People otherwise just won't do it. So change is going to be the new normal. And as we say in pretty much all of our presentations, adapt and change, get away from that's the way we've always done it, or become irrelevant in your community. And so many times I've been working with systems and state representatives, other county commissioners come in and say, I didn't know we had a bus service here. That's a bad sign. Or isn't that the bus for the elderly and disabled? I hear that maybe 6, 7, 8 times a year from some of my clients that have a reputation of being the bus for the elderly and disabled. So change is essential, or you're going to become irrelevant, or you're going to go belly up, which is not a good thing. Okay, change will be the future of transit. Of that, I think there is absolutely no doubt. We can't predict the future, but we know change will be the future. And you know, it's COVID. Obviously, it's related to COVID. It's certainly related to the fear a little bit, the fear of the virus. But in the end, it's going to be this change in the way we live our lives, this reduction in the need to travel. As more people go online rather than go out. And we're seeing this all over the country, how people are adapting. Some of the big ones here in the health field are really going to impact transit. And each one of these a little bit, but taken as a whole, they're going to have a significant impact. Telemedicine, some of us have already done it pre-COVID. Where you can go online with your doctor or even sometimes over the phone and get your needs taken care of, as opposed to going to the doctor's office. Telehealth, which would be counseling, therapies, those other non-necessarily medicine-related health trips. A lot of those are going to be cut back. One of my friends is a counselor, and she used to do everything in person, and now all of her clients, all of her patients are video. Telemonitoring, you don't have to come down to be monitored, to be checked out now. It can be done on video, and a lot of insurance companies are now accepting these things. And I think we're going to be seeing more of this in the Medicaid field as well. And for many of our systems, healthcare access is absolutely critical. Delivery services, people aren't going out as much anymore to go shopping. The grocery stores are not very full. They're doing a lot of business, but most of it is associated with deliveries. You've all seen the Amazon trucks everywhere, UPS. I mean, it used to be a big event to see one of those trucks come down my street, and now it's 5 times an hour. And some people are going to like that and get used to it. Working from home, I think we all know about that. In some cases, the workers are going to say, yeah, I'd rather work at home. And some businesses are going to say, yeah, I can reduce my rent by having these people work at home. And it's not going to work for everybody, but it's going to work for a lot of people. Then at the same time, we're seeing some new modes. Microtransit started coming on fairly strongly before COVID. I see it clearly has a place, and some of these other new modes may have a place as well. And then, of course, the new normal is probably going to include social distancing for a long time until we get this done. And that may linger with people just being nervous. And we'll talk some more about that, especially when we have a brief discussion about vehicles. Some questions for the new normal. When will the public be ready? When will they have confidence in transit again? Transit's going to have to take a lot of steps to ensure the public that the service is safe. One of my clients said to me just the other day, he has put in new filtration systems on his buses that he's using. He's not using all of them right now, but he's put new filtration systems on. He has a strict regimen for disinfecting, and he says, but no one knows. So that begs the question. Obviously, the new normal is going to require a lot of marketing, a lot of building confidence in transit, and this is going to be a recurring theme this afternoon or this morning. So we'll talk some more about that. Will transit ridership return to pre-pandemic levels? As we mentioned, some of this new normal is going to reduce ridership in some cases, but many rural systems are pretty much transporting captive riders, those that don't have a choice, and the captive riders are their bread and butter. And I would suspect, although of course we don't know, but I would suspect those systems that rely more on captive riders are going to see their ridership come back a little bit quicker than those that rely more on choice riders. For rural transit, of course, in most systems, captive riders or the transit-dependent riders are the key, are the bread and butter. Will new strategies be needed? We're going to talk about this in a few minutes related to service design. But you know, we keep talking about the microtransit apps. We talk about immediate demand response, but in the end, fixed routes still going to be the bread and butter for many needs, and is certainly typically the most productive in many cases. So we can't forget fixed route out there. The new normal, funding of service. Will there be additional federal funds available for transit? I'm obviously confident that transit's going to continue to be funded. It has never not been funded. But the question is how much stimulus, CARES, whatever kind of money you're going to call it, is going to be coming our way. And another recurring theme in this workshop is you better be ready. Better be ready for the funding. You better have your plans in place. You better be ready to go. Let's talk a little bit about service design and cost control. It's not just paratransit or fixed route anymore, as I think everybody is starting to learn and understand. And when we talk about service design, we talk about a lot of things. And as I said, I can talk about this subject for a day and a half, and I have. And I'm reducing it to just a few minutes. And I think what we need to focus on is issues, getting to the heart of the matter, is issues like cost control and productivity. Productivity is clearly one of the key elements. It's absolutely essential for success. Building that productivity as high as you can, while at the same time ensuring safety, quality of the service, and appropriate service. You know, if you're running a paratransit service and you want to get your productivity up, as in one system I worked with, he kept increasing his productivity, making his drivers go a little bit faster. And after a while, all of a sudden, he started getting visits from the police. And they were, he was also the procurement officer for the city, so the police weren't going to get him mad. And they said some of your drivers are driving much too quickly. Some passengers were saying that the drivers are going too quick. I don't have enough time to board, all those sorts of things. So they reached and exceeded their paratransit ceiling. So when we talk about productivity in paratransit, we have to understand that there typically is a ceiling. And when you try and go beyond that ceiling, the safety and the quality of the ride are reduced. So we always have to understand that. We have to understand in productivity that we always want to use the most appropriate service for any particular individual. So with that understood, in reality, the best way to lower costs is through productivity improvements. And we'll demonstrate that in a minute. At the same time, the service design that you select dictates the productivity. If you choose to go with a countywide paratransit, then you're going to have one type of productivity. If you choose to go with a fixed type of service, fixed schedule type of service, your productivity will be a little bit higher. And as an example here, when we're measuring productivity in one-way trips per service hour, the example is that we have on this slide here is, let's assume the operating cost is $50 an hour, and the per vehicle hour, and the vehicle takes 2 trips per hour. That yields a cost of $25 per trip. But if that vehicle can maybe change its service design a little bit and have some scheduled service and be able to group a few trips, maybe they could take 4 passengers per hour. That cuts the cost to $12.50 per trip. 10 trips per hour, if you're able to get a group of 10 or a group of 5 at one stop, 3 at another, 2 at another, 10 trips per hour, the cost per trip is now down to $5, which means for the same amount of money, you can transport a lot more riders. So that's the key to productivity. That's what makes productivity so important, and something that in all the work you do, you should know that you should have your productivity at your fingertips. It's something I preach all the time, and more often than not, managers and planners do not know what the productivity is of their various service. From now on, you can learn, and you should have it at your fingertips, always ready to go. It is such an essential number to concentrate on and to monitor all the time. As I say, we spend a lot of time on describing various service designs and the productivity inherent in those service designs. And just as part of the review, I'll kind of go through some of the various service designs and the productivity we typically see pre-COVID, okay? We're not going to talk about during COVID because things are going to get back to a near normal again. Countywide paratransit, if you're operating multiple counties or one county and you're doing paratransit countywide, you're typically only going to get 1 or 2 trips per hour. And of course, your costs are going to be rather high, or you're going to need a lot of vehicles to do the work. In urban paratransit, ADA, wide open and paratransit, all the way to zoned type of service, we see anywhere from 1 to 6 one-way trips per hour. In microtransit now, in town, in a number of sites that we have worked with, both suburban and it's one ex-urban town, we've seen some significant success in going to 4 to 6 trips per hour, and in some cases, the fixed route that was circulating in this one community was doing maybe a half a trip per hour, and they took the same drivers and the same vehicles and they turned it into microtransit, and it's been doing very, very well. Delivering a lot of people to fixed route, a lot of people to the stores and the local medical clinics. So we're seeing those kind of numbers in suburban areas and in smaller towns, and that's a good thing. 4 to 6 one-way trips per hour. Fixed schedule service, which I will describe in more detail in a little while, where different parts of the county or the service area get service at different times and different days on a scheduled basis, so that they know when the bus is coming and they can plan their doctor's appointment or their shopping trip accordingly. Fixed schedule in a county-wide mode can bring us to 6 or 12 trips per hour, and compare that to the first one, the county-wide paratransit, where we're only doing 1 or 2 trips per hour. We'll give you a good example of this in a few minutes, the fixed schedule. As I say in my class, I spend about an hour on it. Flexible routes, flex routes, route deviation, we all know about that, and the productivity really depends on a number of factors, but it's certainly going to be higher, closer to what a fixed route would be. And to some degree depends on vehicle capacity, of course, depending on what kind of restrictions you have for people with disabilities. Plus, it's a way to get around serving with people with disabilities if you do it a certain way, and that's not something I would support myself. That's a topic for another time. Service routes, we know of the service routes where certain areas are targeted to certain destinations, maybe even the Walmart or a United grocery store chain in Texas. And then, of course, fixed route, which is the gold standard of transit. It's what most transit in the world does. A regular fixed route up and down the street. And it has its place in rural transit. Obviously not everywhere, but it certainly has its place. And the vehicle capacity, we see in towns of 20, 25,000 people, if it's done right, and we'll show you some examples of that, you can get 8 one-way trips per hour, which isn't bad at all. Okay, service design, making the right choice. The service design obviously makes all the difference. It dictates your productivity, and it determines to some degree how many passengers you're going to be able to provide service to. A poor service design is like placing staff in handcuffs, expecting better performance. The right choice maximizes ridership. The wrong choice, low ridership. Your system will become irrelevant. More important, your dog won't want to walk with you. Trust me on that. Look at this guy. He will not want to walk with you, and he'll go on the other side of the street. Let's put it that way. And that's not a good thing. And that's what my dog would do. Let me give a little example here. The heart of the problem in the service design. I have it's one example, 2 systems, actually. The first one is a 2-bus fixed route operation of a population of 25,000 people. It's a traditional fixed route design. Basically, it goes in one direction and then it comes back on the same road. So there's like fixed route does everywhere in urban areas in the country. If there's a stop on one side of the street, for the most part, there's going to be a stop on the other side of the street. So it's 15 minutes to the store, and 15 minutes back. This system is doing about, well, was doing about 8 one-way trips per vehicle hour. And for a town of 25,000 people, that's pretty good. The second system is 2 buses in a town a little bit larger, but it has a significant sized university with about 18 to 20,000 people in it. And as of 2 years ago, don't know what they're doing right now, but as of 2 years ago, they had 1.5 hour loop routes. So it was 15 minutes to the store and 1.25 hours to get back home, literally. If they had a transfer to get to the store, the round trip is 3 hours. And those of you that do one-way loop routes, this is what you get. And it suppresses ridership. And in this case, ridership is 2 one-way trips per hour. And we know they should be doing at least as well as that first system. We know that. So let's take a little bit closer look at why. Someone might say on that second one, well, obviously fixed route doesn't work here. Okay, obviously it doesn't work. We're only getting 2 one-way trips per hour. Well, let's look at that a little bit and see how obvious that is, that it doesn't work. I have had the great pleasure of having opportunities to work in Paris. Well, I don't know about that. Paris, Texas, obviously, and I never get tired of the Paris, Texas jokes. They have a service there. It's a fixed route. It's 2 buses operating 4 routes. And you can see the bus goes out, goes up north, comes back along the same route. And most of the routes do that. The green route has a little bit of a loop on it, but not too bad. For whatever reason, they did that. But for the most part, if you get on the bus, if you get off the bus on one side of the street, when you want to come back, you cross the street and you get back home in the same amount of time. And this is a traditional type of fixed route that any city can do, any small town can do. The second example, we're not going to mention the name of the community because I don't like to embarrass people too much. Sometimes I do. The manager there once said to me, we put the service out there, but they won't ride. Okay? This has 2 1.5 hour one-way loops. So 15 minutes to the Walmart, 1 hour and 15 minutes to get back home. That doesn't meet the ice cream test. Your ice cream is going to melt. Now, if you're on the other route, if you live on the other route and you want to go to the Walmart on the blue route, you have to transfer. That requires a 3 hour round trip. And I see this all the time in communities all over the country. It's close to impossible to ride. I have actually ridden this bus and the Paris buses, but I've ridden this bus a number of times, and I have never seen more than 2 people on the 1.5 hour loop on any of the routes, on either of the routes, either of the times I rode. And the people we talked to on the bus said, this is the only way I can go. It's 3 hours round trip, but I have to get to work. Another one said, I'm getting a car next week and we're going to carpool from now on. So some people might say, this fixed route doesn't work in this community. Let's try something else. That may not be the case. Maybe if they did a route design that made sense, that got people where they needed to go and then got them home quickly without spending 3 hours, literally 3 hours, more people would ride. I don't know, but that's what I would suspect. So we have to look at how we design our service. Does it make sense? Put yourself in the rider's position. Ride the bus, go to the Walmart, buy some ice cream, and then go home, taking you 2 hours. See if the ice cream melts. Well, we know it will. Okay, enough of that. As I say, I could talk about that topic all week long, but I'll cut it off for now. Okay. Let's talk quickly about renewing, reimagining, and or reinventing transit. How often have we been hearing those terms, especially the reimagine and the reinventing, okay? And there's nothing wrong with that. I think it's good. It's important, but we need to consider that when considering a change, understand that the concepts of passenger transportation, the movement of the people, and the logistics, the planning still apply, and most of all, productivity still matters. So we need to be able to make sense of the service. This is a rural transit. By the way, this picture in the background is a rural transit system in Texas that hasn't yet changed. I was going to say who that guy is standing over by the coach there, but I won't. Okay, renewing, reimagining, reinventing transit, applying the right service to the need. I tried to group, for the purposes of today, I tried to group the different types of services into three basic types that have changed over the past few years. The fixed family of services, as I like to call them. We have a fixed route in town with supporting complementary paratransit typically, or you could have a flex route for in town, or flex routes are really good for long routes. A lot of the areas I work in, they have 60, 70 mile long routes, and it would be crazy to try and have a paratransit vehicle serve that. So they flex into the various communities to occasionally pick people up that need that door-to-door service. So the flex route is available for that. And then again, we get to this fixed schedule service. Some of you, if you haven't been in one of my classes, are saying, what in the world is that? Again, I apologize. We will get to it shortly. Demand response service is now in two different forms. The old school is still that in advance demand response, which is what we typically see in rural areas still. But demand response microtransit type of service, or as I'm calling it now, instead of dollar ride, I'm calling it app a ride. I don't know if that'll catch on. But in areas that can't support fixed route that are not strictly rural, if you can't support a fixed route with at least 6 one-way trips per vehicle hour, if your fixed route there is getting less than that, or you know it won't, then you really probably want to look at microtransit. Small towns, suburban areas are real appropriate. In a study I just recently completed, the town of Dulce, New Mexico, in the middle of the Hickory Apache Reservation. I was riding on the bus there, and we talked about the bus comes to town every couple of hours, and it spends an hour, hour and a half circulating on this crazy route that nobody knows. So our thought was to deploy microtransit whenever the bus is in town for that 2 hours, and riders can use a smartphone, or they can call to get a ride. And I was on board with about 3 other riders and the driver, and I asked, does anybody out here? And I looked, and we had cell phone coverage, and I said, does anybody here use smartphones? And everybody responded in unison, we all have smartphones. So we're getting over that issue. Some still don't have smartphones, but you can still call to access this service. So this is something that's really up and coming, but you have to remember, it has its place. Okay, so applying the right service to the needs. So with that, let's perhaps open it up for questions. Liz?
Sure. Thanks so much, Ken. We don't have any questions right now, but I guess if people want to take a moment to think of any questions you'd like that you have for that first section of the presentation, feel free to type that into the Q&A area of Zoom. And we did get a question about the slides. We will be posting those on our website on nationalrtap.org/webinars, and the recording will be there too. So all this great information will be accessible to you afterwards. So we do, here's one question. that went into chat. I've heard 10 rides per hour as a threshold, but you cited 6. Any thoughts?
10 rides per hour to switch over to from Microtransit? If that was the question. I haven't seen, there may be claims of 10 one-way trips per hour on Microtransit, and I've heard some of those, but that may be for a very small area, because when you think about it, picking up 10 people and dropping off 10 people in 1 hour, just to pick up alone is 1 to 2 minutes, and the drop off is 1 to 2 minutes, including the time to get over there. So you've got 2 to 3 minutes per person. That's 30 minutes just to pick up people. So the logistics of that seem to me to be a little difficult. The actually transporting all those people. What I have actually seen in sitting in with dispatchers and meeting with planners in the 4 or 5 systems that I've looked at is that 4 to 6 one-way trips per hour is a pretty good guideline, and that's pretty good for Microtransit. There may be cases where it can be up to 10. Again, if the trips are really small, really short, if you have any groups, yeah, your productivity is going to be a little higher. But in a normal suburban, ex-urban type setting, some of these more rural communities, I would think 4 to 6 one-way trips per hour would be reasonable. And if you're doing a fixed route that's getting more than that, I probably wouldn't change it. But, again, you never know. And I'm just speaking in general terms. There's always exceptions.
Thanks, Ken. I guess the other, the bigger question here is making that determination of switching from fixed route to demand response, or, making those changes. So if you are going to speak to that in your presentation, or I know that's a big topic. But,
yeah, we'll talk a little bit more about it, but it all boils down to meeting the most appropriate need for your community, and working with the head of planning in via Transit, which is not the via app, but via Metro in San Antonio. This fixed route guy says that he loves this Microtransit in these suburban areas. He says 50% of the riders transfer to fixed route. It's a great feeder. And he also made the point the quality of the ride is so much better for everybody. So he's a big urban guy, and he's all for this in its place. So they're getting about 4 to 5 one-way trips per hour, but he's so pleased about the quality of the ride and the fact that they feed so well into the fixed route that he's happy with that. So yeah, it really depends. But if you're in a regular normal area and you're just going to get regular riders, no groups or anything like that, I would think 4 to 6 trips per hour would probably work best.
Okay, great.
Okay, great.
We do have some other questions,
okay.
And let's see, it's 2:38. We'll see how we get through these, and then maybe we can take the rest at the end if we don't.
Yeah.
So here's one. In our very rural Southwest Georgia counties, the counties outsource to regional transit partners. Seniors who use the service to go to the doctor can sometimes be on the bus for up to 8 hours without breaks in the summer. Do you have any advice for how to address the issue with the regional transit without running into funding issues?
Definitely some kind of a fixed schedule service so that you don't have people having to get picked up all over the place. I'm not sure why anyone is riding 8 hours. Obviously, if the service is 3 hours away, then yeah, they may ride 8 hours, maybe 8 hours. But if it's an hour away or a half hour away, obviously that should never be happening. And perhaps they're trying to do too much with a demand response type of service, going door to door. If they implemented perhaps a fixed schedule service, that might be something that could help them a little bit. We talk and I've been down in that area, and so There's no reason, unless the trip is really long, that somebody should be riding for 8 hours. If you tell them, if you want to ride to Valdosta or wherever you're going to, that the bus goes Monday, Wednesday, and Friday at 8 a.m. Then you're going to get 6, 7 people on the bus, or maybe, or 2 or 3, and they're all going to go pretty much directly in, and they might make stops along the way, but it'll be along the way according to a schedule. So that's, you know, that to me sounds like a service design issue, and you can do a lot more with something like a fixed schedule service.
Okay, and if Grace, you still have want to clarify, you know, what the funding issues you're concerned about, or anything else? If that didn't fully answer your question, we can follow up about that at the end.
Yeah, and I'd be happy to chat some more even offline. I've done some work in Valdosta, been there a few times, and had a few good meals there too. And as anyone who knows me knows, that's important.
All right, we got one, I don't know if this is a question, more of a comment that employee recruitment is a challenge. So a lot of the drivers, excuse me, like they've lost 20% of the drivers. So that might be an issue, just not being able to have enough staff, as we having to reduce service because of that.
And I'm sorry.
That's it.
That was a problem before the pandemic too, and it's even worse now. And what I'm doing in my plans is throwing in a caveat. You know, especially in the remote rural areas, how do you recruit drivers up in Chama, New Mexico? You know, it's you know, the plans are subject to the availability of drivers, and that's the caveat I throw in there. That whatever you do, the drivers are absolutely essential, and it's been hard enough previously. It's got to be even harder now to be able to recruit drivers, especially when they could work for delivery services for more money, and they don't have to get any back talk from the riders, so to speak. I'm kidding. So you know, it's understandable. So we're going to have to think of other ways to get drivers, maybe more money. But some of our great plans are tempered by the fact that we can't get a driver to get up that early, you know, and we don't have any other options. So yeah, that's also part of the issue is the drivers, and I suspect that's going to continue for a while.
All right, one more question before we move on. So here's a question. We're going through a route study now, and they did mention the difference between loops and straight routes being large and getting people to ride.
Good.
In your experience, is the location of the route what makes the determination?
I would never do a loop route that's more than like 20 minutes, maybe a half hour. There's no reason, a one-way loop route. There's other ways to design your routes that don't require loops. You know, you look at that Paris route or some of the others, you can cover pretty, you know, there's good coverage and there's bad coverage. Just because you're a line on a map doesn't mean it's good coverage. And if you have a 3-hour round trip, but you're covering the entire city, that's terrible, you know, because no one's going to ride. So you have to have meaningful service, and that's just, I would avoid a one-way loop more than a half hour period. You know, you can go out halfway and come back, and then go the other half and come back. That'll work, and you're still covering the same area, and no one has to ride for an hour. So there's creative ways of doing that.
Okay.
And next time I do the service design class, hopefully that person can be in it, and we'll talk about it.
Sounds good. Well, any other questions that came in, we'll take a
Yeah.
look at those at the end. So go ahead and continue.
All righty, excellent. Okay, what's the plan for the post-pandemic? I hope you all are thinking about it, and I hope in this section we can kind of give you a few more ideas, a few more things to think about, because this is new to all of us, and the more we can be exposed to different ideas, the better, and then we can decide which ones work, which ones don't work. So in addressing the post-pandemic era, one of the key questions each transit manager has to ask, and this goes back to, are we going to reimagine, reinvent, or just renew? Do we retain our previous structure, or do we change the way we transport people and maybe go from a fixed route to a microtransit, or from some kind of demand response or even a microtransit to a fixed route? And my answer to that is not of obviously not knowing yet what the new normal is going to be, is that if the system functioned well in the past with good ridership matching the best service design to the need, maybe they had some good fixed routes, they had a couple of microtransit zones, and they had real good ridership on both of those services, I wouldn't change them. I would maybe fine tune them. There may be a little bit fewer riders, but these are still clearly going to be the best modes for your service area, if it's functioning well, if you're happy with your productivity and your numbers. But if you're less than satisfied with your service and the way things are going, then yeah, maybe reinventing or reimagining is what you need to do. And this would be a great time to get that planning done because of all the downtime. So if it's the latter, if you're ready for a change, then yeah, I would start planning right now. And then once and then to be able to initiate when the new normal comes out, when the post-pandemic comes out, you can deploy this new service. It would be real clean and fairly easy to do if you're able to get relatively speaking, if you're able to get the word out and then basically renew, reinvent when you go back to regular service again. So it really depends. But in terms of the types of service designs, they're going to remain pretty much the same wherever you are. If fixed route's most appropriate before the pandemic, it's probably still going to be most appropriate. Microtransit, most appropriate before, it's probably still going to be the most appropriate. So that's my look on the key question. So you as a manager has to decide, what do I want to do? Do I want to reinvent, or do I like what I have right now? Maybe look at some of your peer systems and see how they're doing as well, and kind of compare and contrast. So planning for the post-pandemic. Here's what I was working a long time on this. I had the misfortune of doing a big project right in the middle of when the COVID hit, right in the middle of the project. And I had to completely switch gears as to how I was going to do the planning. And what I see is until the pandemic ends, transit planning is not going to be a year-by-year thing. We don't know what a year is anymore. We don't know what service is going to be like in a year. So how do we know? How are we going to plan for a new normal in 1 year if we don't know that there's going to be a new normal in 1 year? So we've come up with a number of categories for planning purposes. And the first one is planning during the pandemic. It's what are the things that you do while we're in the middle of a pandemic? And there's plenty to do. The second one is, okay, we're starting to recover from the pandemic. We're starting to get out of the woods. The deaths, the infections, everything is going down. The vaccines working, all these things. That's a different phase. That's when you start to build back. Then you have the post-pandemic phase where life is now pretty much getting back to normal. Maybe the all clear has sounded. And what do you do then? And then finally, we get to the new normal. What is the new normal going to be? So initially, the little description for this course said 3 phases, but no extra charge. You get a fourth one free. Okay. So those are the 4 stages of pandemic planning, basically, operations planning. Okay, so during the pandemic, now is clearly not really a good time to implement major changes for one main reason, that you inaugurate new services now and no one's going to ride. or very few people are going to ride. You're going to have empty buses. You're going to take a lot of criticism unless you're able to significantly tamper down the comments and tamper down expectations. But if it was me, I would tinker. I wouldn't make major changes now. I would wait until ridership's coming back to implement the major changes, or just before it comes back, because you're going to have a lot of empty buses, and you know people are going to criticize. So what should you be doing during the pandemic? And many of you hopefully are already doing most, if not all of these things, this is a great time to tinker with those. If you're running fixed routes, or even if you're doing demand response, it's a great time to tinker with your routes or with your schedules. In demand response, great time to tinker with your subscriptions. But it's a good time, maybe change the schedule a little bit, maybe do a little modification to the route, maybe add some bus stops. The low and the no cost changes that ridership is low, and it won't have much of an effect on ridership, but you'll be able to get those changes out of the way. These are things that maybe you've known you should be doing for a while, or that your planner or your consultant recommended that you get done. I know in this one system I'm working with, there's a whole list of projects that they can do during the pandemic, fine-tuning the routes, all things that they wanted to do but never had the time. So this is a good time to do that. And at the same time, you want to be planning for your post-pandemic service changes. So you want to maybe get your planner out there or hire your consultant and start to think about what service are we going to reinvent, reimagine? Or are we just going to stick with what we've done in the past because it works? So plan for that post-pandemic service change. Those things should be done right now, while we're still in the depths. That should be done right now. Writing grants. This is the perfect time to be writing grants. Another recurring theme that I've already mentioned once is that there's going to be a lot of funding out there, and everybody needs to be working on that, focusing on those things. We'll talk more about that. But deploying new technologies, planning for new facilities, and really important, and this is throughout the pandemic, this is absolutely essential, closely monitoring the service on a daily basis by route. And we'll discuss that in detail. But this whole planning during and after the pandemic relies on very close monitoring of service. Okay. I'm having a technical malfunction. There we go. Okay, let's talk a little bit about operations planning for fixed route. These are things that most of which you should be doing anyway. But while you're getting ready, while you're preparing you're in the pandemic and you're preparing to get out, some of the steps you need to take for operations planning. Obviously, again, the theme of monitoring the service. And this goes over and over again. Ridership by time of day. I would track my fixed routes. I would track each one individually, and I'd make modifications based on the ridership of each one. And the ridership is ultimately going to determine how your recovery takes off, when you're going to start the recovery, when you're going to get back to the new normal. It's going to be based on your monitoring of your ridership. Analyze and plan your changes that you need, minor modifications, as we talked about, timing, routing, hours of service for when you get out of this thing, new run cutting, whatever you need to do to plan for moving forward. Then go ahead and even during the pandemic, make those small service adjustments. That's really a good time to do it because it affects the fewest number of riders. Adjust the schedules. Timing might need to be changed, adjust the routes. I know this one client wanted to change the street that they turned down one block. This was a great time to do it. And then, of course, determine any additional bus stops that are needed, any shelters, benches, those sorts of things. And again, just like you do in operations planning, test and finalize the schedule. And typically the way I test, especially a fixed route, is I get out there with a vehicle operator and simulate a driving of the route. And then that's basically how I time it. Old school. Public meetings, hearings, if warranted, are obviously essential as well. And then training is absolutely critical. What I recommend for fixed route is that you have a template for each route that gives every single turn, every single movement that the bus is supposed to make, so that any driver that gets in that bus has been trained on it and knows the route. You saw that route earlier that just kind of went all over the place, and we see that a lot. And I've was working with a system where I rode the route one time and the driver did it one way. He was new to the route. I followed the bus another time. The driver did it a different way. And then one of my staff rode the route, and that was a third way the route was done. Well, you're not going to get good ridership if you change your route every day. If people waiting for the bus don't see the bus. So it's real important, especially if the route's confusing, to have stop by stop, turn by turn directions. That's something worth spending a little time doing. Okay, for demand response service, right now a lot of systems are limiting their productivity in order to do social distancing. So in those systems, tracking productivity is not essential right now, although it's so important. But if you're limiting your productivity right now, what you should be tracking is denied trips. And otherwise, you should also be tracking ridership. This is a good time to modify standing orders to maximize efficiency. You know, with standing orders, the more efficient and effective they are, that pretty much drives your efficiency and your effectiveness for your entire system if you have a fair number of standing orders. If using technology to schedule service, this might be a good time to review and refine the service parameters. Get your update, and then train, and train. Keep repeating myself. Okay. Test your changes, and then what you need to do is consider, or maybe even before that, consider moving to some kind of, instead of that demand response a day in advance stuff, consider moving to immediate response type service. You know, when someone calls and wants a ride, it doesn't take a day to schedule the trip. It takes 15 seconds for the most part. And using the technology, it takes even less time than that. So consider getting away from that day in advance stuff in the towns and go to some kind of immediate response. Or consider in the rural areas, consider a fixed schedule service. There's that term again, fixed schedule. Well, this time, we're going to talk about it. Everybody's getting excited now. Fixed schedule service. This is a good example from CARTS in Texas, sorry, but this is a great example. And let's look at the second city, the second community served, Fentress. It's probably a few hundred people there. But if you live in Fentress in Caldwell County, you want to go to San Marcos, the bus goes the bus goes Thursday, and it leaves at 9 a.m. and returns at noon. If you want to go to Lockhart and get some of that incredible barbecue there, the bus goes on Monday at 9 a.m. And if you want to go to Luling, Friday, okay? You look at the next town down, Lockhart. That's a much bigger town, about 10, 12,000 people. And it has local service Monday through Friday, if you want to ride local, 8 a.m. to 4:30 p.m. If you want to go to Austin, it's on the interurban coach, and then you go to that schedule, and it's Monday, Wednesday, and Friday, and then you consult that schedule to determine what time the bus goes. If you want to go to San Marcos, it's Monday, Wednesday, and Friday, 8 and 2 p.m., returning at noon and 3 p.m. That is, in essence, what fixed schedule service is. This system divides it up by county. So every county, every community, is the smallest of communities, and believe me, some of these communities, Prairie Lee is pretty small. Some of these communities are, 50, 100 people, but everybody gets served and everybody gets served according to a schedule. And they're able to, when they pull out of Fentress to go to San Marcos on Thursdays, they may have 3 or 4 people on board, as opposed to 3 different people calling over 3 days wanting a trip. So you have to go out there 3 different times. This covers the same thing with 1 trip. That's the power of the fixed schedule service. And I recommend this for most areas, most rural areas that are out beyond whatever the local town is that's in the middle of your county, and dividing up your service area appropriately so that you're serving certain areas, certain times. Now, if you were to examine this closely, some of the people coming from, say, some of these communities, they're actually going to be on the same bus. So you might be going from Luling to Martin, picking people up in Martindale, and then picking people up in McNeil or whatever, and then going into San Marcos. So not only is each area scheduled, but the bus is scheduled to make stops along the way. So that is fixed scheduled service in 5 minutes or less.
I have a question.
Yes.
And I'm gonna, I can ask midway, so I'm going to, I guess.
Good.
So this would be, in finding the location in these communities, it would be like, if there's a Walmart or something, that might be the location that the bus goes to, or if there's a
Yes.
Medical center, it's just
Yes.
really depends on the community and the demand.
That's exactly how this is set up. There's reasons why they go to these communities, and they have to do with medical, with shopping, absolutely. And yes, and of course, Walmart is key to a lot of this.
And do
So,
the
absolutely. So the schedules make sense, and what they do is they consult with doctors' offices in the larger cities that they're going to make sure they're on board with the times, the days and the times. So that in many of these medical facilities, the social worker, the caseworker there, or the receptionist knows that this person lives in Fentress, so they schedule them for Thursdays. So getting the cooperation of the healthcare community is very, very important on this as well.
And for the origin of the route, they have to get to a central location?
Not necessarily. There's typically you can pick people up. That's the beauty of this. You can have people picked up at the door in these communities, or you can also allow them to go to the bus stop in the middle of town, let's say, and get the service that way. So yes, you can do either one. Mm-hmm. You know, if you go up there, you get up to Fentress, and it takes you 15 minutes to pick up 4 people and take them into town. That's good. That's a good thing.
Right. So it's flexible depending on the system.
Yeah.
And you mentioned standing orders. Did you, in a previous slide, did that mean subscriptions, or what did you mean by standing orders?
Same thing. Standing order, subscription, the terms are synonymous. It just depends on where you are. But yeah, they're basically the same. And you know, those standing orders are valuable. And another good thing about if you're operating paratransit and you want to change it, one of the things you have at your disposal is you have all your origins and destinations. You know where everybody's going. So a lot of times we'll plot origins and destinations on a map, and all of a sudden, wait a minute, if we design a route here, we can pick up 80% of these origins and get to these 80% of these destinations, as opposed to doing all this one-on-one crazy stuff. So a lot of times, having that information from your paratransit service on origins and destinations can be a real valuable planning tool for the future.
Okay, thanks so much, Ken. Sorry to interrupt.
Great. No problem.
If people have questions pertaining to a particular slide, maybe we can do that too. But so keep them coming if you have other questions, and otherwise, go ahead, Ken. Thank you.
Great. Okay, we talked about some of the other activities. One thing we learned from the stimulus back in 2009, and we've learned since, is that those who have a plan basically get to the front of the line. If you're ready to go with your plan, whether it's a facility, an expansion of service, and you want to go after some of this CARES, stimulus, COVID money, whatever it is, if you've got the plan in your pocket ready to go, you are going to get to the front of the line. Political connections aside, but you will get close to the front of the line, and you will have more success. So this is a great time to write grants for funds, and to be ready, have your plan ready for when this grant money comes out, and then you can grab it quickly. We do a lot of grant writing for our clients, and it's pretty much, it's what we do. We write proposals. It's the same thing. So we know if you got the plan ready, you can get the money. And again, it's also a good time. One system I'm working with is going to be deploying some microtransit in the very near future, and they're hoping to get it deployed before the pandemic ends, so they can spend some time testing it and working out any bugs. So it's a good time to deploy some of those different technologies during the pandemic, so you can work out any bugs, and any minor hiccups won't be noticed by very many people and won't affect very many people. We talked a little bit about this, instilling confidence in transit. This will be a consistent theme under the new normal. I suspect, but I don't know, that people are going to want to continue the social distance. That may be part of the new normal. So start to build confidence now, and we'll talk in a little bit more details, but don't cut corners, okay? Don't mess around with that. One of the pictures that we use here, and one of the pictures we use here shows a bus with plexiglass shielding all around, and it has 3 riders on board. And 2 of the riders were wearing masks, and 1 of them wasn't. So, like, okay, you've just blown the whole deal here, you know, by staying in an enclosed area without a mask and rendering the plexiglass less than successfully useful. So one of my staff put that in the presentation, and I said, no, I don't think we can do that. That's not a good idea. So we didn't, but they've done a great job in helping build confidence if they could just get that one guy to put a mask on. Okay, informing the public of the fine-tuning changes taking place, informing the public of the service changes as they're about to occur. We're going to talk about how to recover and how to react quickly to ridership changes and get that service out there. And part of that quick reaction is getting the word out to the public, getting them schedules available, hard copy, online, however it's done. And that's going to be part of the quick reaction necessary, which is what we're going to talk about here. So, recovering from the pandemic, when it becomes clear that life is starting to recover and ridership starts to increase, transit systems should start the recovery period. Starts with real careful monitoring of ridership and rapid identification of trends. So that means literally daily monitoring of your ridership by route, so that if you see one route, all of a sudden its ridership is spiking, you're going to move quickly to get that service back to where it was, rapid response, and address that ridership. And there's a couple ways to do that, and we'll talk about that. Then near the end of the recovery, when you clearly see the light at the end of the tunnel and it isn't another bus coming at you, you can start to revise your vehicle needs at that time. Right now, it's hard to calculate when you're going to need new vehicles, because we don't know how many vehicles we're going to be using from month to month now. So that's start of the recovery, and again, monitoring the service in the time of COVID. Close monitoring, we talked about it, blah, blah, blah. But in terms of, for the purpose of monitoring ridership during COVID, what we're looking at is for fixed route, one-way trips. Typically, I think that you should be looking at it every morning the next day, see what ridership was the day before, by route. So again, if one route sees a significant increase, but another route lags, you could put the resources onto the route that's getting significant increases. In demand response, again, productivity is something you want to look at to maximize your productivity. But if you're limiting your productivity now due to COVID, then you want to look at trip denials, because if your trip denials are starting to come up, then okay, maybe we need to do something, whether it's increase productivity or deploy more vehicles out there. That is a decision that you'll have to make. The next question that you as a manager or as an official have to make is, are you going to be reactive or proactive in terms of the recovery? And this decision has to be made on a case-by-case basis. Do we increase service in anticipation of the ridership coming back, being proactive, or do we wait for the increase in ridership and then hopefully react quickly? And that's the reactive portion. Either one can work, and a lot of it depends on funding, like everything else. My recommendation would be, if you can, if the money's there, I'm sorry, weird stuff. If the money is there, be proactive. Get out of the head of the increase in ridership. It's the old build it and they will come. But if you can get out a little bit ahead of it, if you know ridership's going to start to come back soon, things are changing, get that service back out to the near normal or the new normal. And the other option is obviously waiting. If you can react very quickly within days of a ridership spike, have new service out there, have the marketing, the promotion out there, then you can do the reactive approach. But if you're slow, you run the risk of poor service, slow overcrowded vehicles, and non-social distance. And that's a great way to lose ridership. So if you really want to lose ridership, do that. But if you can react quickly, if you know you can call that driver back into duty within 3 days, you can have those vehicles up and running and those schedules all done, those new schedules all done, then if you have to be reactive, you can definitely pull that off. So that's some important considerations. The third set of activities will occur post-pandemic, and this is most of the expansion activities. While we talked about it's a good idea to conduct operations planning for the new service during the pandemic, implementing the service expansion should wait until at least that recovery or the post-pandemic phase when you're pretty sure ridership is starting to return to normal or whatever the new normal is going to be. I would not implement a new service before that. Again, you don't want to run the risk of hey, they're running empty buses. Or what they said at the start of a transit system I worked at for a while, what's red, white, blue, and empty? Okay, you don't want those jokes. They're not good. Okay, post-pandemic activities, no let up. Don't let up. Continue the close monitoring of ridership, as well as other non-COVID issues, of course, but that you may be able to back off from the daily once things stabilizes, but watch it carefully. Look at it at least weekly. You don't want a trend to get out ahead of you, whether it's a spike in increase in service or a reduction in service. You want to know about that pretty much when it's happening. You don't want to, at the end of the month, see, hey, how come ridership dropped off 10% this month or at the beginning of the month? Well, you want to know about that the next day. Continue marketing confidence in the service and the service changes clearly. And once the all clear is sounded, it's time to bring the service back to a new normal. So what is the new normal? That's the question we've been waiting to answer for quite a while. It's to paraphrase a Supreme Court justice, we can't define it, but we know it when we see it. You can look that up, or don't. So what is the new normal? As far as I can see, the new normal is number one, is a few things here. When full service is in place, when you are back to running your full or just about full level of service, when all your protocols, your safety protocols are in place and enforced. There's nothing like having a rule, but not having anybody pay attention to it. If you don't enforce the rule, it's like not having the rule. The third element of the new normal is when the community has confidence in the system and the service, and everybody's holding hands. Okay? And then the last part of the new normal, when ridership is stabilized at least close to the pre-pandemic levels. See, and in this picture, everybody's wearing masks, and hopefully we won't have to do that forever. So that is pretty much how we define the new normal. And again, it's a case-by-case basis. You will know it when you see it, when ridership has come back, at least close to what it was with any luck at all. Okay, just about to wrap up. Just a real quick on the vehicles of the future. Excuse me. Will preparedness for a future pandemic drive the vehicle of the future, or are we going to go back to the way things were? What image should be sent? Obviously, a driver with a mask following CDC guidelines is a good thing. Some systems I work with, when they reduced their service, even for their paratransit, they deployed their largest vehicles so they could apply social distancing. Where they once might have used a minivan, they're now taking a large cutaway bus. And again, in the future, will people want to ride in a small van or a sedan with three or four other people in close quarters? When will that occur? Will it ever occur again? We don't know. New filtration systems are coming out. I think all new orders of buses should have new filtration systems that can turn over the air in a vehicle in a matter of a minute or two. Shielding between seats, as we see in this picture. This is the picture that has the guy without the mask, and we cut him out. But you can see the plexiglass shielding, mainly for the driver, and then of course disinfecting, having a regimen for disinfecting. I think some of these things are going to stick around, but we don't know. Lastly, sometimes everything means nothing. And those are words to live by the way. Sometimes there are exceptions. Sometimes when I think something absolutely, there's no way this can work, it does. And then sometimes we consider something a slam dunk and it can still fail. So everything means nothing. But if in doubt, we recommend going the extra mile. Appropriate service changes, expanding, cleaning, disinfecting, filtration, CDC guidelines, open up the service in advance of ridership, being proactive. These are the kinds of things that while doesn't guarantee confidence and service increases, ridership increases, it's going to help. So with that, just real quickly in terms of resources, I'm not going to state all the different resources out there, but National RTAP guidebooks and webinars have some great stuff. Transportation Research Board, TCRP reports. I'll make a plug for TCRP 223, Healthcare Access to Transportation. It's in pre-publication. You can get it now, and it's absolutely fantastic, if I do say so. Just kidding there. State and regional associations are a great source of information, especially COVID related, but also APTA, of course, and CTAA, Southwest Transit Association, and so I've done a lot of work with them over the years. And of course, COVID related information, all the state, regional, and national associations RTAP and TRB are all, APTA, CTA are all good sources of information on COVID specific issues. There is no shortage of information right now. So with that, we will open it up to the second round of questions, if there are any.
Thanks so much, Ken. And while we're on the topic, I can give people a minute to, if you want to take down Ken's information. But we do have a slide in just a minute about some with direct links to some of our resources, and then examples of things that we have, like TCRP resources and others that are in our library. So thanks for mentioning that. We do have some, especially our Transit Managers Toolkit, which is a really great source with a lot of information about planning, including requirements for reaching out to the public, all kinds of things. So I'll now show my screen and can share that with you, and we will take some questions hold on, I have to get back to, wait. Mine actually is not ready. Hold on. Let's get to the bottom. So we did have a couple, but I'll feel free to ask Ken questions. Let's do. Oh, come on. All right, I'll get through to that one. I did current slide, but anyways, here's a question we have, maybe, so this was Scott Billingsley, if you're still on. Sorry, this is kind of annoying, but I'm gonna go this way. He said, we are trying to cover a 230 mile area with 13 towns. We have 7 buses. Our wait time from one end to the other is 3 hours. What type of setup would be best for us to try to use?
Depending on what the service area looks like, if you can link up all the communities in a line or some of the communities in a line, you can operate kind of a fixed route, fixed schedule service, so that as you come into each town according to the schedule, you can pick people up at their door and then move on to the next town that's on the schedule and the next town until you get to the big city, or some other kind of scheduled option. You really need to get, rather than letting people just go one-on-one or whenever, you have to channel a schedule and different days for different people, different areas of people, to be able to target them. And maybe they get 1 day a week service. A project we recently did, there's one community of about 500 people that wasn't getting any service at all. So we implemented 1 day a week, 2 round trips from out there, one early and then one later. And all of a sudden, they're getting 20 people that ride that bus on that 1 day every week. And it's a lot better than if it was paratransit. There might be 20 different one-way trips back and forth, as opposed to 2 round trips that took 20 people. So I would look for some kind of scheduled service that makes sense. You can still pick people up at their door, but let everybody know when the bus is going to be in town, so you can maximize the number of people that get on board quickly and then move on to the next town and then get to your big town.
Okay, thank you.
Yeah.
Here is one about fares. In rural Ohio, our transits have all gone fare free for transit services. What is your opinion about trying to keep fares free after the pandemic?
I'm a fare free guy. The amount of money you typically get from fares is not that much, and if you can afford it, fare free is going to get you the most ridership. Clearly, the more the fare, the lower the ridership. System I work with in central New Mexico, as I mentioned earlier, they have sales tax revenue, and they are fare free, but they have sales tax revenue, and their ridership normally reflects the fare free nature. They get pretty good ridership on that system. So yeah, if the money isn't that, if the few bucks that you get from the fares isn't that important, good ridership is. So you can cut your fares and keep your fares low and keep your ridership higher. Yeah, I think it's a good thing.
Okay, thank you. Here's another question about funding. Small systems and local governments are thinking about how they'll fund transit in the recovery and post-recovery periods if US DOT returns to traditional federal and local match ratio. Do you have any thoughts about the future of local funding and match sources for smaller systems?
We've had some success. We're into this public-private sponsorship thing, where we sell sponsorships to Walmart, to the oncology center, the hospital. Maybe they get a bus wrap, maybe they get promotional maybe they're on the system map, and they pay for being a sponsor, and then they get benefits. Walmart has a number of opportunities now that they have to be able to get money from them, both from the foundation and from the regional managers, something they did not have in the past. So the regional managers are now empowered, and in some states, in some cities, they're funding transit. In Michigan, I know in a number of locations over the years, Muskegon, I think Kalamazoo, don't quote me, they were actually paying a private provider to run fixed route service according to a schedule that they had posted. So we know they'll kick in, we know they'll give out grants, and we know that other organizations, well, getting back to Paris, Texas, they generated $150,000 in local revenue through sponsorships in 1 year. It takes someone to be able to sell, but who's got more money? Walmart or the state of Montana or the state of Wyoming, or most places? The answer is Walmart. They have more money. So why not go to them? Supermarket chains have gotten involved in this in a serious way. I know my local supermarket chain, HEB in Austin, has paid for routes over the years to their facilities from senior complexes, low income areas, those sorts of things. So a lot of times they will pay good bucks for that, and they're getting a good deal because they get some good advertising out of it. So that's what I would recommend in terms of, if you want to seek out more funding, that's, other than writing the usual grants, which you should still do, try and go to the private sector and see what you can get. And the local managers, like say of the stores or the Walmarts, they're not empowered. You really need to get at least to the regional level. So that would be my recommendation on that one.
All right, great. So there's been a couple of questions about additional webinars or workshops, especially around the loops and more, service planning, which obviously it's harder in this kind of format to get into those specifics with communities. So that is something, this is to the audience, that we'll have a survey after this, and we'd love to hear what interest there is. Maybe it's something where we can organize some smaller workshops where there can be some more one-on-one. So please fill out our post-webinar survey so that we can plan for additional events that can help you. And someone asked about KFH, what trainings you have, but my understanding is you just do them at conferences or through other organizations. Is that right, Ken?
Well, we do all kinds of trainings, state conferences, regional. We've done a lot of one-on-one. A lot of the work I do is hands-on, working with dispatchers and management. So yeah, there's a variety of ways that we can help folks. Yeah,
so feel free to reach out to us or Ken directly, and we'll work together to provide more education and training on this topic. There's another question about, are you seeing any tribal agencies making major moves towards microtransit options? So are you seeing that in the tribal environment?
Well, that's kind of interesting because one of the things I'm working on right now with North Central Regional Transit District in northern New Mexico is a microtransit app on the Hickory Apache Reservation in the town of Dulce, which I mentioned earlier, where the vehicle comes out there every couple of hours and spends 2 hours just circulating around on some kind of route that nobody knows. So people if they don't know the driver, they don't ride typically. So what we're thinking is get the app out there in that community and let those people use that app. And as I mentioned when I wrote, they said everybody's got a smartphone out here. So and the cell phone coverage was good. So yeah, I see that kind of thing working on reservations and tribal transit systems, and ways of operating your routes. I know one tribe I've worked with, their fixed routes for work didn't get into the towns they needed to get into until 9 o'clock in the morning, and then they left at 4:30 in the afternoon. So you couldn't even use them for work. So lots of things like that. But it's pretty much, the needs in tribal transit when it comes to transportation and logistics is pretty much the same as any other areas of, similar terrain and similar landforms. The differences are cultural and political in all the different communities we work in. So the concepts are fairly similar, and I'd love to see we're really pushing to get this microtransit app working in Dulce. So I'm really excited about that one.
All right. Well, we have 1 minute. We did get one more question, but I'm going to see if maybe that's something to if you can address offline about a specific case. So again, here's these resources. The PDF will have the links, or visit our website. And if you have trouble finding anything, please let us know, but we'll send you this afterwards. So I just want to plug a couple upcoming events. We do have one about our Transit Managers Toolkit was updated recently, and it does have some new content. There's, for example, a section on leading during a pandemic and in communicating with the public. So a webinar in a couple of weeks will be about those new sections. I think we could all use some of this. We have a relaxed stress management workshop in February based on our Healthy Habits technical brief. Our colleague Kara is going to be doing that. And then we have an intercity bus roundtable. So if your system isn't connected to the an intercity service, or you're interested in intercity services and the FTA 5311F program, please join. And we have a survey that's on the registration link to share any questions you have or topics. So those are some things coming up. But if you get our e-news, you'll find out about other events and resources. And I did want to, as I mentioned earlier, we'll have the slides and recording on our website, nationalrtap.org/webinars, within 1 week, I'm sure sooner. And if you need alternate formats or a transcript, please let us know. And I think that's it. We just really want to thank you, Ken, for a wonderful presentation today. Hopefully you saw some of the comments in the chat that this was really helpful, and hopefully we can work together on upcoming follow-ups. And want to thank everyone for joining us today. It was great to have such good attendance, and yeah, keep questions coming to us. And
Yeah, if you have a question for me, shoot me an email. I will get back to you. I promise.
Thank you so much, Ken. And
My
everyone,
pleasure.
take care. Have a good rest of your week, and hopefully we'll see you at another event soon. Maybe in person
Thanks,
one day.
everybody.
All right. Bye. Thank
Bye-bye.
you.